Okay, I'm back one last time. Now I have the pleasure of introducing our keynote speaker, Dr. Maya Ragavan. I hope I pronounced that right. Okay. Dr. Ragavan, there's a lot of letters after her name. MD, MPH, MS, is an assistant professor of pediatrics at the University of Pittsburgh. She is an NIH-funded violence prevention researcher who is passionate about using healing-centered approaches to supporting survivors of IPV in healthcare settings, as well as engaging caregivers in dating violence prevention. She sees patients as a general pediatrician and also teaches and mentors around community-partnered research with a specific focus on language equity. And we're very lucky to have her here today. Welcome, Dr. Ragavan.
Thank you so much. No, thank you. Great. Hi, everyone. Good morning. Thank you so much for the opportunity to be here and to speak with you today. Before I get started, I always, thank you for that beautiful introduction, but I always like to share a little bit about what got me into this work. And please forgive me, the person that I usually honor just passed away, so please forgive any emotion. All right. So I started doing domestic violence work when I was a teenager. It's all inspired by my Masi. So any Hindi speakers in the room, Masi is mother's sister, but I think in all cultures we know that that's a very special bond. And so she was a survivor, saw the trauma that she went through. I saw her son get taken away from her, and they were separated for many years. But then I also, as we all do for the people in our lives that are survivors, I saw the healing. She was a small business owner. She was a very loving aunt and friend, and just a wonderful and beautiful person. And she passed away recently of lung cancer. So thank you for letting me honor her. And I apologize. Usually I don't cry as much, but recently when I present about her, it is definitely very emotional, but this work is emotional and this work is really personal. And a lot of us do this work for that reason. So please forgive my emotion, but I'm hopeful that we can honor her through this presentation. And then I know that all of you are honoring survivors in your life through your work and through this conference. So thank you for letting me share. So I'm going to be talking today about adolescent relationship abuse. So I'm going to be focusing specifically on adolescents and young people. I'm a pediatrician. I love working with adolescents and young people. I love working with caregivers and other adults who support adolescents and young people. So I'm really excited to be sharing today. I also want to say I know I'm in a room of experts. I am so humbled to be here. Many of you have years and years of experience, so I come here just to share some ideas and thoughts and maybe some conversation, but I also want to share how humbled I am to be in this room of experts today. No conflicts of interest or disclosures to report. So I live and work in Pittsburgh. So Pittsburgh are the stolen lands of the Osage, Lenape, and Shawnee people. I pay tribute and respect to their present, past, and future people, community, and culture, and commit to continued gratitude for the gifts of nature, along with ongoing respect, care, and stewardship of the land, each other, and future generations. And I want to share that a lot of the work that I'm presenting was done in partnership with Futures Without Violence, Project Catalyst, and also want to acknowledge Kim Randall, Jamie Sidani, and Liz Miller, from whom I adapted some of these slides. So today I'm going to be sharing a little bit about adolescent relationship abuse and health impacts on young people. I'm going to be reviewing different types of adolescent relationship abuse, particularly substance use coercion and economic abuse, as well as social media coercion and other ways that we're seeing coercion show up. I'm sure many of you are also seeing coercion show up in these ways. And then discuss some strategies to support ARA survivors. So I know this is a really difficult topic. I have already cried. It is very emotional. So please take care of yourself. I'm sure many people will say this throughout the day. Please take care of yourself. If there's anything here that is distressing or making you feel emotional, please do what you need to do to take care of yourself. That is the most important thing. So I'm gonna go through some introductory slides pretty quickly, but I want to start with what is adolescent relationship abuse. So it is a person using a pattern of methods and tactics to gain and maintain power and control over a dating partner. And I'm specifically talking about the context of being an adolescent or young adult. So adolescence ranges from the age of, sometimes people say, 10 to 26, sometimes people say 12 to 21, sometimes people say 13 to 21, but it is a wide sort of range of incredible brain development, incredible developmental change, independence. It's a really wonderful time. I love working with young people because it's such a amazing time, and there's so many incredible normative experiences that they're having, and it's also a time that can be really challenging, as we all know, and it's a time where having scaffolded support from peers, from adults, can be really helpful. And so when I'm talking about adolescent relationship abuse, I'm talking about IPV that is during that time. We know that ARA is very common. I think, like the introductory speakers were sharing with IPV more broadly. So this first study is from 2015, and it showed that about 69% of US high school students who have started dating, and then about 1/3 total, have experienced physical, psychological, or sexual IPV at some point in their lives. Studies that have looked at digital abuse have shown around, 1/4 to 1/3 as well. And then CDC data shows that around 1/4 of female and about 15% of male survivors of adult intimate partner violence experience partner violence for the first time before the age of 18. And what I love about being a pediatrician is you can focus on prevention and leveraging social supports really early on. And so I think that that's a really exciting thing that we can all do to support young people. And so I've been asked a lot, I'm sure many of you have been too, about what has happened with ARA during the pandemic. And I've got to say that the data is a little bit hard to find. I don't think there's a lot of research that I've been able to find for ARA specifically. There's more for adult IPV that has looked at whether IPV changed during the pandemic, ARA changed during the pandemic. A 2021 study found that around 12.5% of young people experienced sexual ARA and 8% physical ARA in 2021, which was slightly higher than in 2019. And then a CDC study showed around 18% experienced sexual violence. And so that was, I don't know if folks had seen the recent I guess maybe it came out about 6 months ago, the CDC data that showed an increase in sexual violence and mental health symptoms for young girls in particular. So that's that data. And then this study actually, so the third one was done in Nairobi, and this study was looking at help seeking, and they found that help seeking increased from 2020 to 2021 around ARA from 11% to 22%. So it's hard to know, is that because folks were having difficulty with help seeking during shelter in place in 2020? It's hard to specifically know, but there was an increase in help seeking around ARA. And I think a lot around the experiences of young people during the pandemic. So work that I've done along with Virginia and Futures Without Violence and other folks as well, were interviewing advocates around what was it like to be a young person during the pandemic, particularly around, those who were experiencing ARA. And there was a lot of discussion around challenges of lack of affirming spaces and isolation that really made it challenging for young people. And so these are two quotes from that study. So we asked youth advocates a little bit about what it was like for ARA, for folks experiencing ARA. And the first person talked about how there's been such an emotional burden, the political landscape, and how it's really emotionally impacted Black and Brown and LGBTQ youth too. And then the second person was talking about gender nonconforming and non-binary students that were really struggling from feeling disconnected from other people, who had families that weren't supportive, and that they had lost affirming spaces. And that actually was a huge sort of theme throughout this work, is the loss of affirming spaces. All of these spaces that for young people were there for them and were supportive to them may have closed down or changed, and that was really, really challenging. And so, as we sort of all know, ARA is really rooted in power and control. So this is the teen power and control wheel. And I'm saying this now because I'm going to talk about a few ways that power and control can manifest. But sort of the fundamentally IPV and ARA is rooted in power and control. And our wonderful introductory speakers talked a little bit about this already. But oftentimes when we think about IPV, ARA, we think about sort of the violence and the control happening at the the interpersonal level, the relationship level, which certainly it does. But I know all of us have seen the ways that structurally oppressive policies and practices are used by people who use violence to control survivors. And so I do a lot of work in the immigrant and refugee space. And I know that I'm sure we've all seen the ways that our US immigration laws are used to control survivors. I've had young people talk to me, particularly whose parents were living without documentation, about how their partner were threatening their parents, were threatening to call immigration on their parents. And so really the ways that sort of these oppressive policies at a broader level are being used to control survivors. And I think that that's so critical to this conversation, because when we disrupt and dismantle those oppressive policies, we are supporting survivors in that way. And so just a couple things. So a note about gender. So we've already heard about how gender diverse folks are more likely to experience IPV. The same is true for ARA, for adolescents and young adults. Gender diverse adolescents and young adults are much more likely to experience ARA. Historically, often gender diverse has been lumped in with LGB. That is changing. We know research is now trying to be more thoughtful about ensuring that everyone's voices are heard through this work. Emerging work is really considering a range of gender identities and trying to be gender inclusive. And through that work, we're really finding these disparities, which are very much rooted in genderism and in transphobia. When with research, talking to young people about how a partner may threaten to out them or threaten to cut off access to services. And so I think that is really important to ensure that we're centering their voices. And then supporting boys and young men. So this was, I really want to credit Futures Without Violence for this, because they shared this report with me, and many of you may have read this report by Equimundo. And so it's a really interesting report, and I would recommend reading it, because it's just really important for us doing this work to know this. And many of what the findings were in this really resonated with me, with what I was seeing in my clinical practice and with my work. But one of the things that I think was really, really stunning, but also so critical for us as healthcare providers and youth advocates and IPV advocates to know, is that the study found that restrictive gender norms are associated with increased violence perpetration, but also found that men with restrictive gender norms were more likely to say they have a purpose in life. And so I thought, as a mother of a 4-year-old boy, that was stunning to me. And I don't know if it was surprising, but it was stunning. And I think really elevates the importance of interventions that focus on things like future orientation and really try to support, goal-oriented initiatives. And a lot of the gender transformative interventions that Futures does and other folks do as well are so critical. So I wanted to share that, because I think supporting, boys and young men is really critical as well to this work. And then, one of my favorite parts of this, one of my favorite things to do in clinic when I have time, is I just love to ask young people what dating means to them. It's pretty fun. I mean, they usually tell me that I'm old by for even using the word dating. But I mean, that's, as for any of you who work with young people, you just got to deal with the insults that come from time to time. But it's really interesting to hear, right? I've heard a lot that no one uses the word dating anymore. Dating is just for old people, and a lot of talking to, texting with, DM'd, found on, what is that? I'm totally forgetting this one social media platform that folks are always finding partners on. But I think this is really important for us to know, because we need to know how young people are finding partners, right? And how that changes over time. And so really hearing the ways that that's happening. So I'd encourage all of you, when you're working with young people, to ask, because I think they really like to share with us. I try to ask from I just want to learn about this. And, and this is actually a word cloud that a bunch of young people in a collaborative that I was running made about what a healthy relationship is, which I thought was really nice. And this is what they think healthy relationships are. trust, getting along, communication. There's giggling in there, which I thought was really cute, hugging, smiling, supportive. So it's so wonderful that young people have a really good foundation of what a healthy relationship is, and the role that we can play in helping them with developing that foundation. But I definitely recommend asking what dating means, and then also what a healthy relationship means. I think that's a really nice place to start when you're having these conversations. And then the other thing that I think is so critical is the co-occurrence between ARA and other forms of violence. So we know that ARA victimization and perpetration are related to other forms of violence, including exposure to caregiver IPV, bullying, child abuse, and neglect. But then different violence experiences also have shared protective factors, which we can really capitalize on. So I'm going to talk today a lot about caregiver and parental monitoring and communication, because that's something that I do work in. But there's so many other things like future orientation, peer support, school support, coaching support. I mean, there's many different shared protective factors that we can leverage, which is really exciting, I think, for this work. And so now I'm gonna just make sure now I'm gonna talk about 2 or 3 different types of coercion that many of you may be seeing or hearing about that aren't talked about as frequently. So this may really resonate with you when you're hearing stories from your work. And so I'm gonna start with substance use. And so there has been a lot of research that has shown associations between ARA and substance use, including non-medical use of prescriptions, vaping, cannabis, alcohol, and tobacco, as well as polysubstance use. What's interesting was I found this study from 2023 that was summarizing all of the different substance use, all of the different research studies that were looking at substance use in ARA, and they were showing whether the studies were statistically significant or not. And this is what it showed, which I think is kind of interesting, because not every single study is showing statistically significant associations between, for example, tobacco or marijuana or alcohol and ARA. And I think a lot of this has to do with, as you all know, every study is set up so differently. Some of them are cross-sectional, some of them are longitudinal, some of them look at ARA in a very broad way, some of them look at ARA in a very narrow way. And so, but I do think that this is important for us to know, because I don't love having like big generalizations without being able to point out the data. It's a really, really interesting report to look at. And then when people have asked adolescents about their perspectives about ARA and substances, this is what they share. They talk about how substances can help them sort of get into a relationship. So it may be a shared interest that they have, whether it's smoking weed or vaping, using alcohol. It's something in common. And then young people also talk about how it helps them cope with trauma. So there's a piece of it that's very much focused on something that they do together, something that maybe brings them closer. And then there's another piece of it that is a young person coping with trauma related to the ARA or other violence that they may have experienced. And then substance use coercion. So Carol Warshaw and others have done so much amazing work in this space. But substance use coercion is using substances in a way to manipulate, control, or coerce. And so research around adolescent and young adult substance use coercion is pretty limited. I think it's a really important area for people to look at and talk to young people about. But for adults, it can look like controlling use, limiting access to help-seeking resources, interfering when someone wants to stop, or for adults as well with children, threats to involve systems, particularly child protective services, and it can overlap with other types of coercion. So this is a quote from an advocate. This is not specifically focused on young people. This was actually focused on perinatal substance use coercion, but I think it's a really powerful quote, so I'm just gonna read it. This is from an advocate. They say, a lot of moms, pregnant people, there's a lot of fear instilled in them by their abusive partner. If you're using, I could tell CYF and they could take the child away. Or if the abusive partner wants custody of that child or doesn't want their partner to seek primary custody, they'll use CYF as a control. And CYF, is in Pennsylvania, the CPS, Child Protective Services, as a control. No one's gonna believe you if you're using, or I'm gonna tell them you're using marijuana and you're gonna get in trouble, actually, if you try to get custody of our child. Or if they already have CYF involvement, sometimes an abusive partner can use that as a form of power and control. So forcing them to fail urine drug screens or tricking them to fail urine drug screens. And so I think as someone, I'm sure many of you work with folks in the perinatal period. So thinking about the ways that systems are layered onto the control, which are layered onto substances to really create these incredible challenges for survivors. And I want to talk a little bit now about economic ARA. And so economic abuse in adults is pretty well studied, and I'm sure you guys have seen it or heard of survivors who share it. A lot of any sort of coercion around finances, ruining someone's credit, trying to get them fired at their job, trying to make them quit their job, trying to have them work a lot. We're doing some work around perinatal economic abuse right now, and one of the big things we're hearing is forcing someone to go back to work immediately after they gave birth, or forcing them to not work. So really anything around finances or employment. For young people, there was a study that Futures and University of Pittsburgh collaborated on to look at what does economic abuse even look like for young people. And we found that it was around coercive and controlling behaviors around employment, education, employment, education, and finances. So there was a lot around education-related coercion, which is really, I think, important for us to know as people that serve young people, when we're hearing things around, truancy, or not going to school or being afraid to go to school, really being sure that we're asking about coercion, because that was one of the things that young people were sharing with us, that their partner was suggesting that they don't go to school or demanding that they don't go to school. And so that was, I think, really powerful. And in this study that we did of over 2,000 young people, this was this study, the first author is Sarah Scott, who's an amazing IPV researcher who works at the University of Pittsburgh. We found that about 47% of young people reported educational ARA, 49% reported employment ARA, and 46% reported financial ARA. So very, very pervasive in this group. And then social media. And so we talked a little bit about social media. I will say I do not like social media. I always try to get into it so I can know what the young people are up to, and then I just get lost and I can't do it. But it is really important because a lot of young people are meeting their partners on social media. A lot of young people are breaking up on social media. I had a young person, a patient, tell me that her boyfriend broke up with her on Snapchat in a really coercive way. And so I was like, oh, tell me more about how that happened. But I think we're hearing about a lot of ways that young people are finding partners and breaking up with partners on social media. And there's a lot of control that can happen on social media. It's a very public platform. So even in the public platforms and then in the direct messages as well. And so some examples of social media and ARA are any kind of cyber or digital control, but then also seeing unhealthy relationships or discussions about unhealthy relationships on social media. So I've had a lot of young people in these groups that I run tell me, have you seen what's out there about relationships? It's horrible, all of this toxic masculinity. And, a lot of people are really traumatized by just scrolling through Instagram and seeing all these things. And then having content shared without their permission as well. And so I think that really us understanding social media is so important so we can better understand, how young people are interfacing with social media. And then one more thing, one sort of other group of studies I want to share is around discrimination and ARA. And so there's a lot of work that shows that experiences of racial and gender discrimination are associated with experiencing ARA, both victimization and perpetration. So work that I've done with young people who identify as Latino, both in Pittsburgh and Kansas City, found that both interpersonal and immigration-related discrimination was associated with ARA victimization and perpetration, which is really, I think, important and powerful when we're thinking about prevention programming. And then work has also looked at how when we think about, for example, the association between bisexual identity and ARA, discrimination explained that association. So it mediated that association was in kind of the causal pathway. And so really thinking about how discrimination can impact survivors. And so I've got two quotes from a study that I'm running now about this. The first is a parent and the second is a young person. So I put the parent quote is in Spanish, so I put it in Spanish, but then the translation. So this parent was talking about how their son was telling them that there was this girl that he really liked, but then she was really discriminating against him, and that now he doesn't want to have anything to do with girls. And what was, I think, really, I don't know what the right word is, it's powerful, but also so incredibly sad, and was that the mom went on to talk about how she was seeing him really say mean things about girls now, that this experience of being discriminated against was leading to him to start to say mean things about girls. And she was actually asking us during these interviews, like, what am I supposed to say to him? How can I tell him? How can we stop these kinds of behaviors now? So thinking about how do we support young people who are using violence as well to make sure that we can break those cycles, I think is really critical. And then the second quote is from a young person who had experienced ARA and discrimination, and she was telling me that she says that I feel like discrimination does have to tie with unhealthy relationships because it creates an unhealthy relationship from yourself from within. It creates, self-esteem. You don't understand how deserved you are or how valuable you are. And so sort of back to this idea of how do structurally oppressive policies and practices, impact survivors. Just make sure, okay. And then we are going to, I know that the next talk is going to dive into this in so much more detail. And I'm sorry that, I know this is kind of a lot of, of different statistics and facts and things to think about. Many of the talks throughout the day are going to really dive into these in more detail, which is fantastic. But there's also a lot of work that looks at how LGBTQ plus young people experience more ARA. And one of my colleagues did a study where he asked young people to talk about what would ask young people who identify as LGBTQ+, what would the ideal dating violence prevention intervention look like? Like, just what would it look like? And they designed it using human-centered design. And the thing, I was talking to him about it, and he said the thing that was really interesting is the number one thing they said were affirming spaces. So later they talked about, we want sort of dating violence prevention programming that's not heteronormative. We want someone to talk to our parents about how to talk to us about dating because they're not doing that, but we want them to do that. But the number one thing they said was affirming spaces. So it really goes back to, even with prevention programming, how do we have structural solutions in addition to some of the interpersonal and individual level solutions as well. All right, I'm gonna take a breath. That was a lot. And I'm gonna pause for a second before I go into some solutions and ideas. Just make sure I'm not over time either. All right. I am going to now talk a little bit about supporting ARA survivors. And there are so many ways to do this. I couldn't possibly share everything, so I'm just gonna share a few. So I'm going to talk about primary prevention programs, particularly considering culturally affirming interventions. I'm going to talk about the use of the universal empowerment and resource provision approach in healthcare settings, which many of you may have heard of, but I think it's a really nice way to engage in these conversations with young people and their parents. And then I'm going to talk a little bit about engaging caregivers and other trusted adults, a little bit about social media literacy, and then some structural interventions as well. And I'm going to go through this quickly. There is a lot more to this, but I know throughout the conference there's going to be diving into all of these topics in a little more detail. And so healing-centered engagement, many of you may have heard this term. So I love healing-centered engagement. I love the idea of thinking about how do we support young people in their healing in healthcare settings. For all of you who work in healthcare settings, you know that healthcare settings are not always very healing. In fact, often they are not very healing, that they can be very stressful, they can be very difficult for survivors. And so I love this idea of how do we reimagine healthcare to be healing, and really be all about strengths. And so, I know the number one thing that I've seen, with survivors in healthcare settings is they feel like their control is being taken away from them, that they went for support and that somebody is taking their control away. And with young people, it's even more because young people already feel like they don't have as much agency in healthcare settings, that things are happening to them without their permission. And so really thinking about how do we leverage strengths. And I'm gonna skip these pieces, but this is sort of generally thinking about ways to be healing centered. The thing that I really love the most, and many of you may do this already, but I always like to either end or start my conversations with teenagers and young people around, tell me about your future dreams, hopes, and goals. Just hear one goal that they may have, one strength that they may have, really to set the tone for the rest of the conversation. And so thinking about how do we bring healing-centered engagement to all these different spaces, I'm going to start with talking about prevention. So there was a recent meta-analysis, which is where a bunch of studies are pooled together. So all the different studies around ARA prevention are sort of pooled together. So then you have a really big sample size and you look at all the effect sizes of all the different studies and pull them together. And so they did a meta-analysis, and they found that prevention programs were effective in reducing physical but not sexual ARA, which was really interesting. And what they found is there was a better effect for these programs when they engaged caregivers. And there was a better effect for adolescents who had a history of violence exposure, when the resources were really tailored for young people who had experienced trauma. And one of the other things that they said in this meta-analysis, but then in other studies as well, is there is a lack of culturally affirming interventions for ARA survivors, for young people, and culture in many different ways, different intersectional identities. And so I thought that was really interesting as well. And so that is a little bit about prevention. And now I want to talk a little bit about how do we support ARA survivors in healthcare. And so many of you may have already heard about the universal education approach, but if you haven't, it's an approach that I feel like works very, very well in my clinical practice and really elevates this idea of healing-centered engagement. So what universal education or universal empowerment is rather than asking young people if they've experienced ARA, we provide education or support or empowerment for all young people around healthy relationships. So I love to talk to young people about what healthy relationships means to them. You hear all kinds of stories and all kinds of things, and then dive into a little bit about what red flags can look like and resources that are available. And I do that with all young people in my clinical practice, and it leads to really rich conversations, and then also will sometimes lead to young people sharing some of the stories of what's happening to them. And I think it's particularly important because there are a lot of studies that show that young people are not very, they don't always feel like healthcare clinicians are trustworthy, and they don't feel like they can always disclose. So a study that we did with economic abuse found that only a third of AYA, reported concern about others finding out or authority figures being contacted, and that's why they said they would not disclose if they were experiencing economic abuse. And then another study that looked at survivors' perspectives on mandated reporting found that 48%, 1 in 2 young people less than 18 did not disclose IPV because they were worried someone would find out. And so I think that is really powerful and shows how if we're just asking people about, especially young people about ARA, we are probably not getting, we're not probably supporting all the young people experiencing it. And I think this actually bears it out a lot in the data. So healthcare-based studies that look at the prevalence of IPV on screening tools that are in healthcare settings find that it's about 1 to 4% of people screen positive for IPV. And we know that that is a very small number of people actually experiencing IPV. And so to use universal education, you can talk about confidentiality for all young people, provide some empowerment or support around what a healthy relationship is, and then provide resources to all young people, and then support if someone were to disclose. And so I think that this approach really helps. I found it really, really helps young people share and open up. But then if they don't want to share or open up, they don't really have to. They can, sometimes they're like, great, thank you for that information. Or they don't say anything at all. Sometimes they roll their eyes at me. Sometimes they're on their phone. But, at least like we are sharing this information with everybody without making them feel like they have to disclose to us. And Dr. Miller, Liz Miller, has done a lot of work looking at cues, and it has shown that it does work in increasing recognition around abusive behaviors, increasing awareness about resources, and then decreasing ARA victimization as well. And then, healing-centered engagement needs to happen at the clinician level, but it needs to happen at the systems level. So, for all of you who are part of healthcare systems, I'm part of a healthcare system. Our systems need to be more healing-centered. Right now, our systems are not healing-centered. Our systems need to provide more time for patients. They need to prioritize comprehensive services and supports. So I have this slide about healing-centered systems. The systems need to be more healing-centered, and they need to invest in these resources and partner with young people when they're creating their policies and practices as well. And then just to finish up, I want to talk a little bit about engaging caregivers. So we know that parents and trusted adults are really critical to preventing ARA and supporting young people who are experiencing ARA. And so this is from our study looking at economic abuse, and you can see that parents, we were asking young people who would be the person you would turn to if you were experiencing these different things. And you can see that parents or guardians were the highest, so 43% said they would turn to a parent, guardian, caregiver, other trusted adult. And what I actually want to point out, which is interesting, is that phone or chat lines were at the bottom. So only 6% said that they would turn to a phone or chat line. So how can we leverage the parent, guardian, friends to share information about the phone or chat line so we can make sure that number increases as well? Because we have amazing helplines available. So we want to make sure that people know about them. And then we know that caregivers who've experienced partner violence themselves may have unique challenges when discussing healthy relationships with their children. I'm sure many of you have talked to caregivers who've experienced partner violence. Some of them tell me that they are too traumatized to talk about this with their child. They really cannot talk about relationships. Some of them tell me I started talking about it when they were 6 because I never want them to go through what I went through. I've heard all sorts of different things, but going into it knowing that the caregiver may have experienced partner violence themselves is really important. And so these are just some ideas to share with caregivers. So this is basically what I talk to caregivers about in clinic and other settings, to center yourself first, to learn about different types of coercive and controlling behaviors. I often suggest that they talk about strategies, or they talk about relationships they see on social media or TV. I always use the example of the Mindy Project, but I'm dating myself because young people don't know what I'm talking about. But I think in this room, hopefully many of you have heard of that. And so, in the Mindy Project, there's a time where she's experiencing pretty severe reproductive coercion, and her partner's monitoring her ovulation cycles. And so I use that as an example of something where you could talk about that if you were watching that together and talk about what that relationship looks like. Helping caregivers come up with clear rules around dating, and then working together to think of adolescents' strengths, and then providing lots of resources, education, information, of which there is a lot for caregivers. And these are just I'll go through these quickly. These are just some conversation starters. I always like to give caregivers some conversation starters because they tell me, they're like, where do I even start? I don't even know. So I have a handout that I give these conversation starters. So these are for more middle schoolers. We talk more about what do healthy relationships look like, what should our family rules be around dating, and then these are with older teenagers. I think it's also really important for caregivers to know how to talk about breaking up with their young people. I've heard caregivers, I remember there was a parent who told me once, I can't believe she just broke up with him via text. It's so rude. I'm really upset that she did that. But then when I talked with the young person, she was like, he was abusive. I did not want to see him. So really making sure caregivers understand that and that they can sort of connect with their young people about that, with their kids about that. And I'm gonna go. Just for the sake of time, I'm not going to talk about this as much, but this is one of my colleagues does a lot of work on helping young people navigate social media. So this is what she recommends talking to caregivers about in terms of social media, which is to teach young people, if they ever see something on social media, to stop first, investigate the source, and find better coverage. So I try to talk to parents about this as well. And then following healthy relationship sites on social media. And so I have this little handout that I give. These are just a couple of wonderful different healthy relationship focused social media platforms that folks can follow. So I always like to talk to parents and young people about this as well. And then just to end, so structural intervention. So I think this is so, every time I talk about dating violence with young people, this is the number one thing that they tell me, is that we want safe and affirming spaces. And so I think that piece of having safe and affirming spaces be part of violence prevention interventions is critical. Firearm advocacy and prevention. So as we all know, U.S. versus Rahimi is right now in the Supreme Court. There is so much co-occurrence between firearms and ARA, and so really thinking about how can we advocate for firearm prevention, advocacy for evidence-based ARA prevention in schools, and then justice-focused interventions for caregivers. So I was talking to a parent, and they were telling me they were like, you know what, I really need to do this is I need a job that is better to me. I need a job that lets me get out at a reasonable hour so I can actually talk to my kids about what you're telling me to talk to my kids about. And so employment justice and really focusing on sort of justice-focused interventions for the caregivers as well is really critical. So, in conclusion, I hope that I was able to share with you a little bit about how ARA is pervasive and rooted in multiple types of controlling and coercive behaviors, that ARA is impacted by compounding structural inequities, particularly impacting sort of young people who've been with marginalized identities, and that we need multi-pronged, multi-level approaches to support, to prevent ARA and support survivors, including a robust response from the healthcare sector, which includes both clinicians, but also the systems need to be more healing-centered. And then here are some resources for adolescents, and I'll go through these slowly, for caregivers, and then for advocates and clinicians as well. And that is the end. And I will, thank you so much, everyone. I'll end with a cute picture of my son. Sure. Okay. All right, so it sounds like we have a little bit of time for questions or reflections, if anybody has any, and definitely doesn't have to be a question if you just have a reflection about something that was shared or something from your own experience. I would love to hear that as well. Yes, ma'am. Mm-hmm. Mm-hmm. Yeah, no, absolutely. So oh yeah, so she was asking about the young people that I did some of the research studies with, like the word cloud I was showing you. Where did I find them? How did they become part of this work? So I recruited some folks from clinic, some from community-based organizations. We have like a recruitment listserv as well. And then some were part of the Youth Research Advisory Board that the University of Pittsburgh has. So they kind of were from different places. Many of them had participated in research around this topic before as well. And we really tried to make sure that multiple people's voices were heard. So we also ran those groups with a simultaneous interpretation in Spanish to make sure that Spanish speaking young people's voices were heard. And so, yeah, it was sort of a group that was pulled together in that way. Yeah. Thank you. Any other questions or reflections? Yeah. Sure. Yes. Of course, of course. Yes.
I love the sign or the poster that you made on relationships. Is there any way you could share a copy of that? I'd love that for my office and to share with others.
Yes, I definitely can. And then Jennifer was saying that the slides will also be available as well. Hi.
So I had a quick question
Yeah.
Regarding, you recommended that parents who have experienced violence talk to their kids. Do you have some best practices around how you do that? I would just be interested in techniques and toolkits.
Yeah, no, absolutely. So I think sometimes it's hard to even know in healthcare settings if the parent has experienced violence. Sometimes they won't, they don't have to, certainly they don't always share. I always just, when I'm talking about this, I always say that these conversations can be really hard for many reasons, including what you've experienced as well. So you should, make sure that you center yourself first. And if you feel like you are not the person that can do this because it's going to be too emotionally distressing, I help them find another adult, or identify another adult that may be able to have the conversations, or think about ways to support their mental health or their, what they've gone through as well. But I think it's really important to just make sure that caregivers know that these conversations can be really hard, which includes if you've experienced partner violence yourself or mental health symptoms, or sometimes parents who've experienced sexual abuse, child abuse, also say these conversations are incredibly difficult to have. And so I really make sure that caregivers feel affirmed in the fact that this can be really difficult, and not to do it if they feel like it's going to be traumatic without additional support in place. So I think that that's really important. I think that focusing on healthy relationships can be really helpful as well. So really just starting with what does a healthy relationship look like? Sometimes focusing on friendships can be helpful too. So I've had some parents who've experienced partner violence tell me that they started these conversations focused on healthy friendships, and it sort of led to the same sorts of conversations, but it was just a little bit of an easier conversation for them to have with their children. So some of those things, I've had a couple parents tell me. I remember I had one parent tell me, "I can't do this. Please, just you do this. I really, it's going to traumatize me." So I said, "Okay, and then, and then make sure that they have support as well. So I think it's multiple different things. So it can be really tricky. I'm sure many of you have felt this way too, is that every caregiver who's experienced partner violence responds to these conversations a little differently because every caregiver's story is a little bit different and their support system is a little bit different. And so I just try to go with what I'm hearing them tell me. Sure, of course, thank you. Yes, hi.
Hi, I'm curious as a pediatrician yourself, like, are you doing this type of education in grand rounds for other pediatricians in your, healthcare system? Is this being taught in residencies? And how are your fellow doctors responding to this information?
Yeah, thank you. That's such a fantastic question. Yes, definitely. I definitely like to talk to other pediatricians about this topic. I try to, I try to fold it into what they're already doing. So pediatricians are already, pediatric clinicians and other clinicians too, right, usually have a time during their visit where they're talking about we call it where they're talking about healthy relationships or sort of normative development experiences and making sure that young people are doing okay. And so I try to help them fold into that. I do a lot of sort of talking about this, especially trying to reframe ideas around screening, a lot of talking about healing-centered systems. I know that Futures does so much with that. The American Academy of Pediatrics does a lot with it. I think it takes time because, as you said, I don't think that there is standardized training for residents, for medical students in pediatrics, but also in other fields as well. I mean, this is really relevant for family medicine, for internal medicine, for OB, for so many different fields. And I just don't think that there's standardized training. And I think a lot of people are really scared. Like the number one thing I hear from my colleagues is, I'm so scared. What if they say that this is happening in their life? Like, what am I supposed to do? I'm so terrified of that answer. And so really trying to affirm them to know that there are victim services, this whole conference, that there are victim services agencies out there that can support them. They don't need to know everything. They just need to know who to turn to and who to connect the young person to, I think can be helpful. But I agree. I think there's a lot of work that needs to be done to make sure this is integrated into training properly. Absolutely. Oh, yeah, sorry. Excuse me. Yeah.
One quick question.
Sure.
During last year's school year, I realized that a lot of the schools do not provide the support or the respect or the respect and support a lot of our students need. As you're mentioning, you're working with adolescents, that's where they're mostly concentrated at. And I found that there's a lot of disrespect for student rights. There's a lot of abuse. There's a lot of discrimination, as well as either because of the gender or the race as well. And also there's a lot of either misguided or negligence as in part of the emotional and domestic violence that a lot of these youth are going through. Because a lot of times that's where they start relationships and that's where the abuse happens, right? And so unfortunately, I see that they're not getting supported by the school, and unfortunately, definitely not by the guardian or parents as well. So is there something that we can do to support them a little bit more?
Yeah, that's a really, really great question. And I totally agree. I mean, a lot of young people feel neither supported by their school, nor by their guardians, nor by other adults in their life. I think, I try to sometimes map out who their social supports are in clinic or in other spaces as well, just to identify who actually are those people. And for those who say none, and I mean, a lot of young people say nobody. When I ask, is there one adult in your life that you can talk to about things like unhealthy relationships, and they just say no, I try to connect them with some of the helplines, with some of the victim services agencies, so at least they have one person. I try to remind them that I can be one of those people, but that is like an earned thing. I mean, you can't just say I'm here for you and have the young person actually trust you. I mean, trust is earned. And so I think it takes some time, but absolutely agree with you. And that's why I thought it was really stunning that only 6% of young people said they would use a helpline, one of the like Love is Respect or the domestic violence hotline. And I think a way that maybe we can provide those resources for young people who may not have other adults in their life that can support them. But I think mapping out, that social support and seeing where you can add to it is great. But it's a really, really good point. Thank you for sharing it, that, a lot of young people tell me that the school is not supportive of them either. Are there reflections or questions? Yeah, no, we're done? Okay, we are done. All right, well, thank you so much.
We want to thank our sponsors, the Blue Shield of California Foundation and the National Health Resource Center on Domestic Violence.